Safari ya ujauzito, huja na uzito wake, furaha kwa wanawake wengi na huzuni kwa wengine.
Nilikosana na buda mtoi. Hakuna nisaidi.
Yote nilikuwa na go through a lot after kupoteza mtoto.
Kupona baada ya kujifungua kwa wanawake pia hujidhihirisha kwa njia tofauti, kama anavyotuarifu Daktari Sauda Faruki.
But the postpartum changes are similar in terms of the uterus, the breasts because of breastfeeding, and in normal delivery you'll have the vagina needs to heal because the baby has passed through there. The external genitalia, the vulva, they even get some swelling, so that has to heal as well. In CS, especially if it's a planned CS, maybe we are not looking so much at the genitalia healing, but just maybe the uterine healing, the placental bed healing.
Daktari Sauda anatueleza kuwa kwa wanawake wanaojifungua kupitia njia ya upasuaji, swala kama mazingira ya kujifungua huchangia pakubwa jinsi mwanamke anavyopona.
You see, elective is a controlled process. You're less likely to get an infection through an elective versus an emergency. Emergency, you've rushed to theater, you've not even had, in as much as we do the antibiotics, we do the cleaning and draping, but it's an emergency situation. This mother has been in labor, so we don't know the environment behind it. Then secondly, also the mother's immunity herself.
Na kwa mwanamke aliyejifungua kupitia njia ya upasuaji, japo inaaminiwa kuwa hupona kwa urahisi, wapo pia ambao hupitia changamoto zao.
It's quite messy after a normal delivery, because for women we have the rectum, which is very close to where the vagina is, and so whenever they pass a long call, there is some element of contamination. A fistula will occur if a mother has stayed in labor for very long. Yes, and so that process, we call it obstructed labor, that can lead to a fistula formation. It's not every patient who's at risk of a fistula formation. Maybe the baby was too big, the mother was too small, she was in labor for too long. So you see there's a number of factors which, yes.
Kwa mujibu wa Shirika la Afya Ulimwenguni, matatizo ya afya ya akili baada ya kujifungua huathiri zaidi ya 10% ya wanawake duniani, na tatizo hili linasemekana kutelekezwa sana humu nchini, jambo ambalo limewaacha wanawake wengi matatani.
And most of the contributing factor mostly is hormones. We have, as women during pregnancy, they go through a whole host of hormonal ups and downs, okay? And apart from that, there are other now outside factors, like if you have a family history, or if you have, personally you yourself went through something traumatic, you are more vulnerable during pregnancy, okay? And so you're more likely to be affected mentally. Now, after delivery, there's 2 hormones that are mostly in play, estrogen and progesterone. They drop.
Na kama wanavyosema, ni jukumu la jamii kumlea mtoto. Mwanamke anapopata msaada kutoka kwa familia au wale walio karibu naye, basi hii ni njia moja ya kurahisisha kupona kwake na kujitunza mwenyewe pamoja na mwanawe.
So mtoto nimengangana na yeye, ni mimi tu ndo mzazi, hata nikisema mzazi wangu anaweza nisaidia hataweza.
In as much as us as the physicians or the healthcare givers, we can to an extent counsel the patient. The most important thing is how she's going home. So you'll see like a single mother is more at risk for postpartum depression, just for the simple fact about the support. Yes, so these patients, these mothers need more care from their family, either sisters, mothers. It takes a village to raise a child.
Robi Omondi, K24.